Hey guys, thanks for making it to the meeting today. So as you all know, we love watching the TV show House MD together, and we usually end up discussing the patient's diagnosis ourselves. And after watching the most recent episode together, I think we have decided to incorporate the show's essence of pharmacogenomics, specifically on the warfarin pathway, into our project. So today, I think we need to introduce our project, divide the task, as well as finalize our coordination plan. Let's also write our discussion points on this whiteboard that's on the screen right now to keep track of everything. Does that sound good to all of you?
That
Yeah, sure.
sounds great.
Yes.
And basically, right, to kick things off, I think that we should quickly go over the significance of the warfarin pathway, as warfarin is a widely used anticoagulant, and its effectiveness can vary significantly between individuals due to genetic differences. So, understanding this pathway can also help in tailoring treatments and improving patient outcomes. As we all usually see in the TV show, this is how it happens, so I'm kind of excited that we get to do this.
That's a great start, Luganya. I would like to add on to it by saying that wouldn't only be exploring the pathway, but also highlight its key components such as the genes involved, its interactions with the pathway and its related pathways, which may impact its function. So this understanding can really showcase the importance of pharmacogenomics in the modern medicine. So how about we just add it on as our first point?
Okay, let me just write it down. Significance of
Yes,
warfarin.
exactly, Kelvin. Now let's move on to the dividing the task. I think we can start by identifying the main sections of the project. For this video, we might need to introduce ourselves and outline everyone's responsibilities. And later the video, we will cover the pathway details and the project outcomes. Also, we will discuss the warfarin pathway on different bases, comparing its components and interactions step by step. Tarun, why don't you start by assigning roles?
Sure thing, Imchen. So first, let's decide who will be handling the researching the warfarin pathway itself. So this will involve the digging into the key genes like the CYP2C9 as well as VK0RC1, their differential effects and interactions. Kelvin, would you like to work on it with me so that we both can cover more parts of the research together?
I'll be happy to. I'll focus on gathering detailed information about the pathway, its differential components, and clinical significance. I'll also make sure to cover its related pathways too.
Okay, let me just put it down into the details, key genes, and differential analysis. Yeah. Okay, so great. Next, we'll need someone to prepare the scripts for the videos. This will include the organizing of the information we gather into clear and engaging content. We also need this person to gather extra information on the pathways and its components, as well as other sectors of the discussion, so that every information that is collected can be connected in a smooth manner, as well as some extra help in gathering more information. Lunya, how about you? Would you like to do this?
Sounds good to me. So I'll make sure that I work closely with Calvin and you to ensure the script is accurate and comprehensive. I'll also make it easy for everyone to deliver their parts naturally. I would also like to gather more information so that I can ease the research workload for the both of you. And so you can write me down for scripts, content preparation, and also gathering extra information.
Yep, I'm writing it down. So gather extra information. Okay, done. So next, perfect. Yunshen, can you take charge of creating the Kahoot quiz and the PowerPoint slides? I think these would be very crucial, especially when it comes to engaging with our audience and summarizing our key points.
Yes, sure, Tarun. I'll design a question that reflects on the core aspect of the pathway, including the differential analysis, and create the slides that are visually appealing and informative, so you can add me on board.
Okay, let me just add the create Kahoot quiz and the PowerPoint on slides. So then lastly, I will make sure to oversee the coordination and compiling of all the information as well as editing the videos. So I'll ensure we stick to our timeline and I put on my task as well. So let me just do that. And I think you guys can continue the discussion while I'm typing it down.
So basically, right, I would also like to add, since that we have this whiteboard, I feel like it's a visual plan, so it will really help us. But then, right, for communication, I feel like we need to share like a Google Drive folder for all our documents and research. For example, our script and also all the information that we need to write down for the discussion itself. And for the discussions, we can either have a WhatsApp or a group chat on Teams or Google Meet, whichever it is that could work for all of us.
I agree with you. Let's try to schedule weekly check-ins to track our progress. Since we don't really have any classes or anything important on Friday, so how about we have it on every Friday instead?
Yeah, that's good for me. We can also use this as a task tracker like Trello to assign and update our own tasks.
Okay, guys, great suggestions. So let me just finalize our plan just to check with everyone again. So Kelvin and myself will be doing the research on pathway details, the key genes, as well as the differential analysis. Lugania will be in charge of preparing the script, organizing the content, as well as gathering the extra information. Yongshen will create the Kahoot quiz and the PowerPoint slides, while myself, I will be coordinating everything as well as editing the videos itself. And we will be using Google Drive, WhatsApp, as well as Trello for our collaboration and the weekly check-in. Do we have anything else to add?
I think that covers everything, so I guess we can just get started and make this project a success, hopefully.
I'm alright with it. I'm quite excited to see how this works out. So let's try our best to make it a success.
Yes, absolutely. I'm looking forward to see how everything comes together.
Fantastic, guys. So let's wrap it up here and get to work. Thanks, everyone. Bye.
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 One day later.
Hey guys, since we have decided to proceed with the warfarin for our project, I have found out a Q&A slide in Kahoot, which the title is To Understanding the Genetic Relation in Warfarin Responses, so that we can attempt together in order to get the general idea of the warfarin pathway. So let's move on to the first question. What is warfarin?
So correct me if I'm wrong, but it's actually a widely used oral coagulant, right?
That's right. It's actually used to prevent thrombosis and thromboembolism. So you can say in layman's terms, it's used to treat blood clotting where in cases as rapid bleeding occurs, it can be used to treat it.
Yes, and I think it also functions by interfering with the blood clotting process, which reduces the risk of clot formation in conditions like atrial fibrillation, deep vein thrombosis, known as DVT, and pulmonary embolism, which is known as PE.
Yeah, that's good. Let's see the answer. Oh, so simple.
Yeah.
Okay, then next move to the next question. What is the mechanism of action of the warfarin? So I did some research on this, and I think it works by inhibiting the enzymes vitamin K epoxide reductase, the VKORC1. This enzyme is actually crucial for recycling of vitamin K, which is necessary for the activation of clotting factor in the liver.
What's vitamin K's role in all of this, though? I'm a bit confused on it.
So based on the reading I did as well, vitamin K is actually supposed to be a cofactor for the post-translational modification of the clotting factors 2, 7, 9, and 10, as well as the proteins C and S. So by inhibiting this VKORC1 enzyme, warfarin actually reduces the synthesis of these active clotting factors, which leads to an impaired clot formation.
Okay, let's look at the answer. Okay, so now let's move on to the next question. So the next question is, what are the genetic polymorphism in warfarin response? So I did find out through the reading that CYP2C9 and VKORC1 are polymorphism that exist in warfarin.
There is also the CYP2C9 polymorphisms in which the variants CYPC29, 2 and 3 basically reduces enzyme activity. So this then results in slower metabolism and also increased bleeding risk.
Yeah, and as well as VKORC1 polymorphism, on the other hand, are variants, for example, 1639GA, which affects the enzyme sensitivity to warfarin. So that is why lower doses are required for some individuals, but it varies depending on their genetic polymorphism.
Oh, so let's look on the answer. Okay. So now let's move on to the next question.
So what are the clinical implications of polymorphism? So the polymorphism actually have a very big impact on dosing itself. So the CYP2C9 and VKORC1 genotypes guide personalized dosing, and there are also like sensitivity groups present within this warfarin, where there is like normal, low, or high sensitivity.
Yeah, the adverse effect of the warfarin, if overdose, may lead to bleeding complications, whereas underdosing may also lead to risk thrombosis. Let's see the answer. Yeah. So now let's move to the next question. So what are the advantages of warfarin dosing algorithms?
What is a dosing algorithm?
Basically, I think dosing algorithms are basically structured tools that guide clinicians in determining personalized warfarin doses, enhancing safety and the efficacy of the warfarin itself. So this is done by incorporating clinical factors such as the age, weight, and comorbidities, lifestyle aspects which are diet and alcohol intake, drug interactions, and also genetic data, which are basically the VKORC1 and CYP2C9 polymorphisms. So taking all these factors into account, these algorithms basically optimize the dosing, reduce risks of bleeding or thrombosis, and improve the INR stabilization. So basically, it gives us an idea of what are the right doses of warfarin to take.
But I also heard there's something called genotype-based dosing, right? That like involves the CYP2C9 and VKORC1 variation.
Yes, the genotype-based dosing of warfarin involves the tailoring of the drug dosage to an individual genetic makeup, which is a personalized medicine to the patients. So the other methods of dosing range from fixed dose methods to advanced pharmacodynamic-based system like the IWPC and gauge algorithm, often integrated into the gene tools.
The advantages that basically stem from these warfarin dosing algorithms include reduced trial and error in dose finding, and as well as improving safety and efficacy.
Okay, so let's look at the answer. So next question is, what are the challenges and limitations of the warfarin?
So I remember reading up on like the issues where there is like complexity of the genotyping, where the genotypes are actually not universally available or very cost effective in the long run. And there's also the issue where non-genetic factors such as like age, the diet, specifically to see if like the person is consuming a lot of vitamin K related foods or the comorbidities can actually affect the dosage level that is needed to be prescribed to the particular person when it comes to the warfarin itself.
There was actually an article I came across the other day that was on direct oral anticoagulants, in which they are a direct alternative to warfarin and is much feasible for usage in the long run compared to them.
Yeah, so let's look at the answer. So these are the answers. So next, let's move on to the last question. What are the future direction of the warfarin?
So basically for this, I don't really have an input on this. Does anyone else here have an idea on what this might be about?
Yes, I have read about it. The future direction of warfarin is a broader access to the pharmacogenomic testing by expanding the access to genetic testing for the variants in VKORC1 and the CYP2C9 can enhance the precision in warfarin dosing. There are also efforts made for the pharmacogenomic testing, more affordable and integrate to the routine care, can enable wider adoption of the personalized dosing.
But I'm also like a bit curious if there are any other alternatives to coagulants that can maybe be developed in the future.
Yeah, currently the emergence of the direct oral anticoagulants, which have fewer directory restriction, predictable pharmacokinetics, and no need for routine monitoring, is reducing the reliance on warfarin. However, the warfarin remains essential for patients with conditions like mechanical heart valve and antiphospholipid syndrome, necessitating ongoing research to optimize its use. So now let's see the answer. Okay, that's all for the Q&A quiz. Thank you guys.
Okay.
Thank you.
Okay, thank you.
1 week later.
So hi guys, so do you guys remember our discussion earlier this week where we basically tried out that Q&A on the warfarin pathway to see what we understand, what we don't? So I also vaguely remember episode of the House MD that we watched, right? I think it was around season 1 and the name of it was called Heavy if I'm not mistaken. So the medical team will basically be treating a young girl named Jessica who will present with, basically she's presenting with unexplained weight and also other symptoms where she'll just gain weight and she'll just have a lot of complications. So during her treatment, right, a medication error will occur and it will involve warfarin, which also leads to like other complications. So they initially will suspect that this is due to obesity because usually weight gain is related to obesity. But then the doctor house will eventually diagnose that it's actually another disease called Cushing's disease, which is caused by a tumor on the pituitary gland that leads to excessive cortisol production. So I realized that actually warfarin is involved in many medical and diagnostic complications. And so basically, these often include bleeding issues and interactions with other drugs or unintentional overdoses that mimics or complicates the symptoms of the primary illness itself. So, since warfarin usually comes up as a part of the differential diagnosis, if a patient presents with unexplained bleeding, bruising, or clotting disorders. But I never really understood, right, like what actually is the role of warfarin in the related pathways and the way it works. So I think we can have a discussion on this. So if anyone knows, you can initiate this discussion.
Yes, warfarin. I just realized that my grandmother had taken it previously after she had suffered from a stroke. I was curious about the drugs and therefore did some research on it. Hold on, let me recall what I read before.
Also, since we're on that topic, I think I have a relative who's a doctor, and once when he was prescribing warfarin to a patient, he told me that if the warfarin dose is too high, the patient may experience severe bleeding complications, including gastrointestinal or intracranial hemorrhage. But if it's also too low, the patient is at risk for thrombosis, which I think we covered in our previous Q&A session as well. And this thrombosis includes deep vein thrombosis, or can even just result to a stroke like what Yongshan's grandmother had. So, especially in conditions like atrial fibrillation or after a mechanical heart valve is replaced. So, basically, during these times, prescribing the dose of warfarin is very important because this could also lead to further complications depending on the patient's health status. So, giving them a high dose is not necessarily always the answer, and giving them a low dose is also not the answer. So, we really need to take the patient's personal health status and history into account before prescribing them the right dose of warfarin.
Yeah, okay. Here is what I read about before. So the warfarin is an oral anticoagulant medication used to prevent and treat the blood clots in conditions such as deep vein thrombosis, DVT, pulmonary embolism, PE, and to prevent stroke patient with atrial fibrillation and prosthetic heart valve. It will work by interfering with the body's clotting mechanism.
But actually, right, since most of these points have been covered up even in our Q&A, but now delving deeper into it, how does it exactly work within the pathway itself?
Well, warfarin works by inhibiting the enzyme vitamin K epoxide reductase complex subunit 1, otherwise known as VKORC1, which is crucial for recycling oxidized vitamin K, such as vitamin K epoxide, back to its reduced form, vitamin K hydroquinone, which is required for the activation of clotting factors.
Yeah, that's right. Let me add on to what Kelvin mentioned also, is that through the use of this warfarin, it's actually able to inhibit the VKOR, the vitamin K epoxide reductase, an enzyme which actually converts vitamin K epoxide, the inactive form of vitamin K itself, back to its active form, which is the vitamin K hydroquinone. So without its active form, the clotting factors produced are actually in their inactive form, which will significantly reduce the ability to promote like blood clotting, So this then decreases the synthesis of the vitamin K dependent clotting factors, as we discussed in our previous Q&A, the clotting factor 2, 7, 9, 10, and this actually results in a decreased prothrombin time, PT, and an increased international normalized ratio, INR, which is actually the standardized measure of how blood clotting is measured.
Yeah, also if you guys are not aware, vitamin K is crucial for the synthesis of clotting factors, like what Darun mentioned before, in the liver, which are necessary for blood coagulation. The liver uses this vitamin K to carboxylate glutamic acid residues on the clotting factors, which enable them to bind calcium ions and participate in the clotting cascade.
So far, right, everything we have discussed so far from the Q&A, it is actually just the pharmacodynamics part of it, right? But what about the pharmacokinetics part that was vaguely mentioned in the Q&A?
Well, warfarin exists as a subspecies which is R-warfarin and S-warfarin, where S-warfarin is more potent and metabolized by CYP2C9, and R-warfarin on the other hand is less potent and is metabolized by CYP1A2 and CYP3A4. The metabolic breakdown of warfarin produces inactive hydroxylated metabolites that are excreted through urine and bowel. So genetic variance in the CYP2C9 enzyme influences the metabolism of warfarin and contributes to inter-individual differences in drug responses.
And with the knowledge of this warfarin pathway, which supports the pharmacogenomics-based dosing, genetic testing for VKORC1 and CYP2C9 variants actually helps with the tailoring of warfarin therapy, which then reduces the risk of adverse events and improves treatment outcomes. So through this actually helps researchers to create personalized medicine based on polymorphism. Yeah, that's about it when it comes to the pathway.
Okay, so I think that we can actually wrap up our pathway, and in order to understand everything that we've done throughout this project, I will just give some of the key points and also an overall summary so that we can gather our information as a final and put it into our report. So basically, right, we have chosen to focus on the warfarin pathway, its significance in pharmacogenomics, and also the genetic variability in treatments. And for this, we basically allocated the task, which is Kevin and Tarun in charge of researching key genes, which was the CYP-C29 and VKORC1, the pathway details, and also the differential analysis. And I basically was in charge of preparing scripts and organizing the content and assisting with additional research. And Yongshan was in charge of designing the Kahoot quizzes and PowerPoint slides. And as usual, he will also oversee coordination and video editing. And Tarun can also help with this. And we used the tools like the Google Drive or Google Meet, the whiteboard and all to make sure this project was had a visual impact on it. And in terms of the pathway itself, right? So we know that warfarin is basically a widely used oral anticoagulant that prevents clot formation in conditions like atrial fibrillation and deep vein thrombosis. And we know that the mechanism of action involves inhibiting the VKORC1 and reducing vitamin K recycling, which decreases the synthesis of clotting factors 2, 6, 9 and 10, like what Tarun said. And also the genetic polymorphisms include the CYP2C9 variants and the VKORC1 variants, which basically both involve reducing enzyme activity, which increases the bleeding risk and also affecting enzyme sensitivity. And then we also learned about dosing algorithms, which is basically the personalized dosing guidance on the doses that we need to use based on lifestyle factors and also genetic and clinical contributions to it. And also the challenges of this include the complexity of genotyping, non-genetic factors, and also rise of alternatives like DOACs. And basically, in terms of pharmacodynamics, we now know that warfarin inhibits VKORC1, reducing the active vitamin K and impeding the activation of clotting factors, resulting in anticoagulation. And in terms of pharmacokinetics, like what Calvin has just explained to us, it exists as R and S warfarin, with S warfarin being more potent. And it's metabolized by CYP enzymes, genetic variations in CYP2C9 influence. And we also know that we have clinical implications such as proper dosing, which prevents bleeding, and thrombosis. And we also know that future directions of warfarin includes broader access to pharmacogenomic testing and development of DOACs, which reduce warfarin reliance, but it keeps it for relevant and specific cases like what we usually see in the House MD episodes. So basically, as a wrap up for our entire project, we can see that our project highlights the pharmacogenomics of the warfarin pathway, emphasizing genetic variability in treatment. And the key tasks which are divided among us were already mentioned above. And also we now can see that genetic polymorphisms in CYP-C29 and VKORC1 influences dosing, which can be optimized through personalized algorithms, and future directions include advancing pharmacogenomics testing and exploring alternatives like DOACs. So as a wrap up, I think these are our key points from our discussion, and if you all have nothing to add, we can wrap up our entire session, and hopefully we all now know more about warfarin.
Yes, I believe that this whole project has been very insightful in understanding how warfarin works, and I hope that our project will be a success and will be approved by our lecturer.
Okay, thank you.
Thank you.
Bye.
Bye, guys.
Thank you, guys.